Good morning, everybody. Good morning. It's wonderful to be back here. I used to teach at St Patrick's School many years ago, so it's wonderful to be back in this neck of the woods with you. My name is Tim Fletcher. I'm on the ministry team at Turpo Baptist Church, and it's wonderful to be here with you this morning. I have with me Dr Belinda Coulter. Now she's not wearing, well, she is wearing her doctor's hat today, but oftentimes we've known her for. My wife and I have known Belinda for 22 years. She's been part of our Turpo community. She has the same age children as us, and her children also used to attend St Patrick's School. We're listening today to Belinda with her consultant paediatrician hat on, a role in which she has dealt with infectious diseases for over 30 years. So things like RSV, is that right? Measles, chickenpox, things like that. So COVID is not new. Dealing with something like COVID is not new. While there's considerable concern with COVID-19 coming into our community, there are some simple things that we can do as parents and community members to make a big difference for our families and for those in need. So we're here to hear about those sorts of things. Now, Belinda, the camera is up there, below St Patrick up there, so we can greet the people who are watching us online. So, Belinda, how will COVID arriving in Turpo affect families? What is something that you see? Do you want to take your mask off?
I just like the TV one. Sorry, I get so used to wearing it now. Well, you know, COVID's been something that we've been hearing about on the news, and it's been something that happens to other people and in other places, and it's really quite strange when and scary, something that we've seen on the news is actually real life going to happen here. And anything new, any change is new and scary, but we can get used to doing things differently. We have got used to doing things differently. We've got used to wearing the masks. Got used to lining up at the supermarket in spaced ways, and to start with it was new and scary, and now it sort of feels normal and not scary any longer. And there's a few more things that we need to do to make sure that COVID's impact on our community is as small as possible, to help people who are vulnerable stay safe.
So how do you see it arriving in Turpo? How do you see it affecting families?
Well, one way it can affect families is, what I really wanted to talk about is how we can isolate together to reduce the impact. So it can affect families by one person in the family bringing it home, or being at risk of bringing it home. And we need to help families plan and prepare for such an eventuality.
So just thinking about that, why would someone be required to self-isolate?
Well, we've watched in the media over the last couple of weeks as people have come to Turpo with COVID, and to our great relief, there hasn't been the big outbreak but that we thought there might have been when we heard that there was something at a bar and something at another venue and then something at Dixie Brown's. And everyone has done the right thing, and the spread across Turpo has been limited. We need to keep on doing the right thing so that the spread across Turpo keeps on being limited, and so that when our young people go out to the community, they don't bring it back to the grandparents. The government's put some rules and guidelines in place to help to make sure that doesn't happen. We can all do our part by having plans, by being familiar with the rules, and by supporting others who are going through that isolation phase.
So there's talk of casual contacts and close contacts. Why is it important to know the difference?
Well, people who are close contacts, and it's really quite convenient in Turpo that we've had a couple of cases. So people who are close contacts are people who've been breathing the same air, essentially, as someone with COVID. So the people who were in Dixie Brown's were considered close contacts, I understand. And so they were sitting there in an enclosed space for a prolonged period without their masks on. Therefore, they're assumed as breathing the same air. People who are trained in this do the assessment and work out who's a close contact and who's a casual contact. People who are casual contacts might be someone who you were in a shop with at the same time, but it was a brief period, maybe a well-ventilated space, and wearing masks. Those are casual contacts. The risk of getting COVID in a casual situation like that is much less, and that's why the masks are so strongly recommended, because it brings that risk even further down.
So you mentioned some locations of interest, and it's likely that we'll have more locations of interest in Turpo.
Yeah.
Who would need to isolate if one of your family members was at a location of interest?
When we go to places, especially restaurants, it's really important that we tap it, using the code, because if you've used the COVID tracer, then your phone will let you know that someone else who's been positive has been there. The public health team interview the person, and then they send a notification alert out to your phone. Now, none of us have probably had one of those notifications yet. So we're not familiar with it, but people in Auckland are more familiar with receiving a notification alert to their phone. If that comes in, it will tell you what you need to do. There are other times when you might discover that you're a close contact, though, where it's not through your phone. So if you've been across for dinner at someone's house and then later someone who was there tests positive, that won't come in through your phone. Now, if you're a close contact and you're immunised, then only you need to self-isolate. But if you're unimmunised, then there's different rules. So once you get to you're a close contact, then there's different guidelines for the immunised and the unimmunised. You want to know self-isolate?
Yes.
So self-isolate means that you need to keep yourself separate from the rest of your family, and that's when it gets really tricky for people who live in big and busy households, because we want to limit the spread and limit the spread, and everything we can do to limit the spread helps to reduce the amount of COVID in our community. And this is where older people in front of me now, can step up and be helpful, because we sure want, if one person in a big family has been a close contact, we don't want a whole family of sick people, So we need to make sure that those who are self-isolating do it effectively. There's guidelines on the United Against COVID website, and it's about having your own airspace, sleeping in a separate room, not sharing the living areas, if possible having your own bathroom, cleaning everything you might have used, using the toilet facilities if you only have one at different times to the rest of the family so that you don't cross in the corridors. All those sorts of advice, and the way you do it is going to have to vary on the layout of the house, the number of facilities available within the house, and the number of people living in the house.
Okay, and it's worth planning that kind of thing beforehand.
Absolutely, because you don't want your 15-year-old to realise that last night at McDonald's there was someone there with COVID and not have a plan already.
Because otherwise you'll see in the media that it's often household contacts that it's passed on, and so it's possible that a family of 5 or 6 could have COVID for weeks because they pass it on to each other. Yeah,
so it's really important. One of the things, as well as stopping COVID spread, it's about protecting families, because if it is indeed the teenager, and teenagers get out and about a lot, they are quite likely to be contacts, then if the family can't enable that teenager to isolate well, then the ability of the income earner to go out and earn an income is going to be impacted a lot, especially if COVID progressively works through that household. So we need to work out ways of supporting and protecting the person who's been a close contact in case they get sick, but also, while we're doing that, limiting the impact of that on the family, both in terms of keeping them well, but also in terms of keeping the rest of that family participating in community life, working, learning, all the things, and having fun.
So just along the planning thing, there is a sheet around that we can access for you that has some questions that it's worthwhile asking the people in your family, and if not you, then certainly people around you, maybe family or other, who live in other homes, just to get them thinking about those sorts of things.
Now, if the person who's been the close contact has been immunised and the family are immunised, the impact on the family is much smaller than in an unimmunised family. If the person can self-isolate and the family are immunised, then the rest of the family are allowed to continue with their daily life. But we need to put special care and support to our friends and colleagues who are unimmunised, because the impact and the risk is much more for them in terms of they then must all stay at home, and once you test positive, you can't even go to the once you are asked to be a close contact, regardless of your test, you should not go to the supermarket to pick up shopping. You should not go to the pharmacy because you forgot to pick up the script that you ordered yesterday. And that's why we need to work together as a community and help each other, so that there's no embarrassment about being a close contact, no embarrassment even if you do test positive, so that we don't have people nipping out to do these little things. The thing about COVID, especially the Delta variant that is going around at the moment, is that you can be giving away and sharing the virus before you feel sick. And it can jump, and it's hard to catch up. So as soon as people receive the message that they've been in close contact, they must stay at home, because they may feel completely fine but be happily sharing the virus, and we absolutely don't want that to happen as a community. So we need to support families to follow these guidelines.
So in preparation for this, is it we go and stock up with toilet paper and flour?
Look, we're not going to run out of toilet paper. It's pretty cheap stuff, and I can pretty much be sure that if you put out a call for toilet paper, someone will help you.
Okay. So what are some things that you could do to prepare?
I think never running out of things is quite a good thing, but not feasible for all families. But for example, making sure that if you do need medicines, if you're on a regular medication, that you arrange your new prescription when you're a week from running out rather than 2 days from running out. Just sensible stuff like that, so you're not really inconvenienced and stressed should this happen. Having friends, so that you've got a pre-arrangement, especially if you live by yourself, so that if you discover that you're a close contact, that you have a friend that you've already made an agreement with. It's like, oh, this happens, we're going to help each other. It
can be like accessing your medication.
Absolutely, yes. Picking up medicines or picking up a supermarket shopping, getting good at online shopping. Although you can't really rely on online shopping, because when something happens, then the supermarkets struggle to keep up with the deliveries. So working together in friends and as a community is probably more effective. Asking someone else to do your shopping.
Okay, so that would help getting to know your neighbour. If you don't already know your neighbour, get in touch with them, and over the fence, talking about ways that you can support each other.
I think this is a great time to get to know our community. Those of us who are part of churches, we have networks of people that will help each other and have people that we can ring. But there's people in our community who are not part of churches, and they're our neighbours in the scriptural sense of the word. We need to step up and watch out for all our neighbours, not just our church friends.
So are there other things that we can do to prepare to help others? So we're thinking about things that we can do for ourselves, but are there things that we can do to prepare to help others?
I think getting together as a community at this time and being cohesive and united, actions like this, talking as a family about, as our biological families, how we can prepare and how we can help each other, talking as our church families about how we can prepare and how we can help our community so that we can all do this together well. If we all do this together well, then we will limit the spread to the vulnerable people. If we help our families with busy, stroppy teenagers to follow these guidelines well and support them to do it, then we will limit the spread to vulnerable elderly.
Okay. Did you want to talk about the Turpo Churches initiative?
Led by Monsignor, we have been getting together to share some ideas so that we can work together between churches and so that we can unite. As you all know, this has been a time where there has been a considerable sense of disharmony in our community, and that's the last thing we need when we're all fighting against a common disease. We need to be working together, and I'm really grateful for Monsignor's support in thinking about ways of uniting as a community to support the non-governmental organisations that are already in our community and to support the guidance that the government has put in place to try and limit the spread.
Okay. I'm just looking through our questions. It looks like we've covered most of them. Is there any notes in there that you... And just while Belinda has a look at that, does anyone have any questions that you'd like to ask Belinda? Do you want to come in? You'll need to use the mic.
So I was just wanting to know that if you've got children under 12 and if they did test positive, would you isolate a parent with them?
Yes. So there's a few things that perhaps we haven't talked about around children. So the younger at the moment, so there's Omicron that we are hearing about overseas, which is not in New Zealand at this stage. But at the moment, with the variants of COVID that are in New Zealand, the risk is proportional to age. The greater the age, the greater the risk. So most children are going to not get very sick from COVID. So firstly, we can be confident about the majority of children, we don't have to worry about them getting really sick from it. It's not like RSV, which we had an outbreak from last year, where we had a lot of sick little babies in hospital. The current variants of COVID, not too bad for well children. That's not to say they won't get sick with high fevers and sore throats, but they're not likely to get sick enough to require hospital, but they absolutely will need the support of a parent while they're sick. And every family's circumstances are going to be different about that, and that's why families need to plan. What will we do if we can't leave children to be by themselves, and so a well parent who's maybe not the one who goes out and works needs to be able to look after the children. Our bigger problem as a community is that when it's the other way around, when the parents are sick and really sick, who's going to look after the children? And that is a big problem that's been encountered across the world, even to the point that, the counting up of COVID orphans across America. And there's lots. So looking after children, yes, of course, parents will always stand up to look after their own children, and we want that to happen.
Are there any other questions?
I had, why do the rules keep on changing? So when we first, a lot of already know the answer to this, that first of all we managed to get rid of COVID from our community and live in level 1 for a long period, and then Delta was so infectious that it leaked through the border. And I don't think that we can be very confident that Omicron, even more infectious, is not going to leak through our border. So the rules will change as the variants change and as we know more, but the rules will also change depending on the level of a number of people in hospital. So our government, and I'm grateful for this, does seem determined to protect people who are more vulnerable. And if there's high levels of COVID in one area or the hospital seems to be getting full, then the government will step up and put extra rules in. So you might see the numbers change about how many days you have to be isolated, or what the rules are for close contacts and what the rules are for casual contacts. And there's another group called Casual Plus that we haven't talked about. Those are all rules based on risk. And so the government is tolerating a certain level of risk at the moment. Now, another thing we haven't talked about at all is antigen testing and testing generally. And again, those rules and guidelines are about tolerating risks, because all the tests that they're using overseas are not entirely reliable. So they have what we call a false negative rate. So they find some, but not all COVID. And so that's why they weren't suitable tests when we were trying to get rid of COVID as a community. But we can use them now when we're trying to keep the levels of COVID down. But you need to know that if you're feeling very vulnerable about COVID, that actually the fast tests that evidently are now being given out at pharmacies in Auckland to help people have the test to get out of Auckland, they'll miss 3 out of 10 cases of COVID, and everyone needs to know this. They also won't pick up COVID while people are still incubating it. For people who are like the one sitting in front of me, really familiar with chickenpox. And most people will know that chickenpox has got a 2-week incubation, so you encounter chickenpox. It's 2 weeks before your kid gets chickenpox. And for the first 10 days of that, the child is not infectious, but then starts being infectious before the spots appear. You can sort of change that and think about COVID, although the time frame is different and there's no spots. So there's going to be a period where the person is going to get it, no matter what you do, but tests won't come back positive. And so testing people 3 days before they leave Auckland will help us, but it won't stop COVID leaking out of Auckland. And you can't entirely rely on the fact that a person had a test 2 days ago is not going to give it to you. That's not to say that we need to live in fear of people, but we just need to keep that in mind in the decisions that we make in our everyday lives.
That comes to the end of our questions, I think. Is there anything else on your notes, Belinda? Oh, you've got a question? Yes, thank you.
I would like to know what you do if somebody has tested positive but is not seriously ill enough to go to hospital. What do we do to care for them at home?
So at the moment, the DHB has put supports in place in Turpo. So it's a really good question, because to start with, everyone who tested positive got sent to Jet Park. And then Jet Park got full, which is the isolation hotel, and that really helped to contain the outbreak by putting everyone in quarantine. It also helped to support the families, because it meant that their wellbeing needs were looked after, and it helped to reduce this jump from person to person through the house that we're talking about, which has resulted in long isolation periods for affected families where there's a big family. There are no isolation hotel facilities at all in Turpo, and so everyone who gets COVID will need to either be admitted to hospital or stay at home. Now, people who have other health conditions are likely to be offered hospital admission if they live by themselves. There's a very strong will to make sure that everyone is looked after well. But those who are younger and don't have other health conditions will be on very strict home isolation, with supports put in place, with welfare checks, and with provision of food and wellbeing, and that is being organised through the DHB. But you're quite right, if we get a lot of COVID in the community, then those systems will start to suffer, because there's not an endless workforce of people to do this work, and we have to keep on doing our ordinary everyday work of looking after all other sicknesses, because all the other sicknesses and accidents are still happening. Does that answer the question, or not quite?
Is there anything in particular that we need to do, like
Medicines to take, or
keeping temperatures down?
so?
If things accelerate?
The people who have been given the job of looking after people have lists of questions. The main thing that is tricky to watch out for is people's oxygen level, and so there's been a lot of purchasing of oximeters to help with measuring people's oxygen level, because that's the one thing that you can't do by Zoom and phone. And so people without other health conditions are likely to be supplied with an oximeter so that they can measure their home oxygen level, and that has happened with the cases that have already happened in Turpo. They've been looked after at home, and they've been assessed by a Zoom with the help of the oximeter, which has been supplied to the family. You know, the little red light on the finger, I'm sure most of you have seen them. And then the person who's assessing by Zoom can see the recording. And if the number, remember I'm a paediatrician, I look after children. So you're asking me a little outside my area of scope. I understand that the cutoff number is 93. And so if the number drops below 93, you get admitted to hospital. So there's no giving of oxygen to people at home that you might have read of overseas. Anyone who gets sick enough to need oxygen gets admitted to hospital, and people's oxygen levels are monitored. COVID is a tricky disease. The virus seems to climb up through the nose into the brain and affect the urge to breathe. So with most chest conditions, if your oxygen level drops, you breathe more, and we can spot. We as health professionals are trained to look for increased work of breathing. But with COVID, the oxygen levels drop without people showing evidence of more breathing or discomfort. And so people can have really low oxygen levels with COVID without looking like they've got air hunger or shortness of breath. And that's why there's been mass purchasing of oximeters.
So can I just put that onto the recording? So the question was, are there any other symptoms? Is that right, Alison? Yeah.
Well, there's a whole list of symptoms that people with COVID get, and they're variable, and things like, and they have changed a bit with variants, and not everyone gets every symptom. Headache is a big one, body aches, loss of smell and taste. So it affects the whole body, not just the breathing. So there are a lot, and high fever has already been mentioned. So there's lots of symptoms, and so if you're in the casual contact monitor for symptoms, which all of us may end up getting because we're at the shop at the same time as someone else who's had COVID, and our phone comes up, says casual contact monitor for symptoms. There's quite a lot of symptoms that are associated with COVID, and headache is quite a common thing to happen to people, and of course can be for lots of other reasons other than COVID, but headache is one of them.
So just thinking that the Turpo churches are setting up a network of people who are looking to help. So if you find yourself, or if somebody that you know is needing help, and it could be delivery of medication, it could be food packages, it could be just someone to talk to. They might be on their own, isolating by themselves, and they're needing some help. So there is help available. So please contact Monsignor or the Turpo churches. Talk to any of the churches; they will be able to help you. The Tukorawai, the Community Food Bank, they also are involved, and so we're just looking to make sure that people aren't on their own. They might be isolating, but they don't have to be alone.
Absolutely, because we really want to do this together. It's really scary time, and especially if your phone pings monitor for symptoms, You know, for me, that would be enough to make me feel unwell. I might get a headache from that. I got stressed coming up to do this talk, as those of you who were talking to me beforehand know. So if I was asked to monitor symptoms, I would probably get a headache, and then I would get even more worried that it was COVID. So we really, really want people, even if they're just at that stage of casual contact monitor for symptoms, to speak up and ask for help so that we can all support each other through this together.
And just thinking that a reliable source of information for, if you've got questions.
Oh, Unite Against COVID is the website that the government has set up to tries to keep up to date with the information. The Ministry of Health website also has information, but the Unite Against COVID-19 is a really good one to go to for the details of who has to do what, especially in a family. And I haven't gone about over all the numbers of days, and because there's so many ifs and whats depending on close contact, casual plus, vaccinated, unvaccinated, that it gets really confusing. And so you can get all the details on the Unite Against COVID-19 website.
I just thought of one question. Vaccinated people, unvaccinated people, are they to be treated any differently? Are they the unclean or anything like that?
No. So the way I think of the current red light situation that we're in is that the people who are unvaccinated are still needing to live in level 3. Like we had to when we weren't vaccinated. I'm assuming that everyone is, because we were told to, check our passes, etc., coming in here, that we're vaccinated. So we, meaning the people in this room right now. But we used to be unvaccinated, and we didn't mysteriously change who we were when we got an injection. At least I don't think I did. And so I consider, the way I'm seeing it is that the people who are unvaccinated are living in like a level 3, and those of us who are vaccinated are living currently, because we're in red, in like a level 2. But we're all just people living in the community together. We've got different health guidelines that we're following to do with our different health statuses. But we're all part of the one community.
Okay, so if we're vaccinated and our neighbour is unvaccinated, that really makes no difference?
No, well, the unvaccinated are more likely to spread COVID if they get COVID. That's absolutely true. But they're still our neighbour. And we absolutely should help them. And remember that if an unvaccinated family comes into contact with COVID, their self-isolation guidelines are much more strict about who has to isolate, so it'll be harder for them, and it might even be scarier for them, because the chances of them getting COVID and passing COVID within the family will be much greater, so they are more in need of our support.
Okay, and that's, I think that we've finished on that note. We're looking for ways to care and support and be there for our community. Yes. So Monsignor has just passed, I'll just show you for those watching online, it's something that looks like that. It's a plan that just asks questions, raises questions that you can talk about with your people in your whānau. Okay, so on that note, if there's any other questions? No other questions? Okay, all right, so we'll finish there. So thank you, Belinda, for your advice and your concern for us. We really appreciate it. Thank you.
Thank you.